My name is Jake Scott, and I'm an infectious diseases physician at Stanford. I've spent my career treating patients and evaluating medical evidence with a focus on vaccine safety and efficacy. I have no financial conflicts of interest. My vaccine research is either self-funded or supported by Stanford University. Since April, I've co-led an international team building what we believe is the most comprehensive database of vaccine trials ever assembled. We set out to answer a fundamental question: what does the complete trial record actually show about vaccine testing? We've cataloged 1,088 randomized control trials from 1941 to 2025, involving over 10.5 million participants. Every entry is publicly verifiable through PubMed links. The entire database is openly accessible. Anyone with internet access can verify our findings. This is what transparency looks like. Our findings directly refute false claims about vaccine testing. We documented 661 trials using inert placebo controls with saline, sterile water, or other biologically inactive substances. Of these, 503 involved antigens that routine childhood vaccines are based on. Most importantly, we confirmed that all 16 antigens routinely recommended for children have been studied in placebo-controlled trials. Every single one. The claim that childhood vaccines haven't been tested against placebos is demonstrably false.
I'm going to lay the COVID injection aside for the time being, but we'll come back because we keep hearing these hundreds and thousands of studies. And one thing I do want to enter into the record is Mr. Siri, what is it, about 2:30 in the morning?
Yes, sir.
Having received testimony, did a very organized and very effective response to Dr. Scott's testimony. And I want to enter that into the record. But Mr. Siri, I'd like you to go to your section and talk about the 661 studies that Dr. Scott is talking about in terms of these inert placebo controls. And just describe that in detail. I think it's interesting.
Sure. Actually, I think Dr. Scott has done a great service in terms of pointing out the lack of clinical trials supporting the safety of the routine injected childhood vaccines. You see, he's saying there are 661 inert controlled trials to support the safety of the routine injected childhood vaccines. But when you actually drill down into those 661 trials, let me give you the breakdown of them, okay? 567 of these trials were not a routine injected vaccine for a disease on the CDC's childhood schedule. They were for HIV vaccines or other vaccines. So totally irrelevant to the safety of routine injected childhood vaccines. The remaining 94 studies, 70 of them did not involve healthy children. For example, trials of HIV positive adults. Again, completely irrelevant to the safety of childhood vaccines. Of the remaining 24, 21 did not involve a U.S. licensed vaccine it was not a vaccine used as a control to license a currently used U.S. licensed vaccine. For example, a Chinese flu shots, stuff like that. That leaves us with three studies, that were claimed to have an inert control that were relied upon to license a routine injected childhood vaccine out of this entire list of 661. And these actually help really highlight the problem we have in terms of assessing safety with regards to the licensure of childhood vaccines. I want good clinical trial data. I need it for my practice. Okay, let me walk through those three. One was a trial for the chickenpox vaccine, the Varicella vaccine. Now that trial had, it was only a few hundred people, so it was underpowered anyway. But Dr. Scott says it's got an inert control, but actually it was an injection of neomycin, an antibiotic. That's not inert. No. And neomycin used topically can cause issues, let alone injected. The second one was Gardasil 4 trial, which had thousands and thousands of girls and women in the control group. Almost all of them got an aluminum adjuvant injection. And then there were a few hundred, only a few hundred, that were labeled as a inert control, but they weren't. They got everything that's in the vial except for the antigens in the alum, which included L-histidine, polysorbate 80, sodium borate, yeast protein, not inert. And then the third one was a Gardasil 9 trial, which finally, by the way, did have a saline injection, just a few hundred. There were thousands and thousands of girls, women in that trial. They all got an injection of lumimaginine, which I don't even know if it's ethical to inject somebody with something that's neuro and cytotoxic, but leaving that aside, the few hundred that got the placebo, but they only got it if they first got 3 doses of Gardasil 4. So again, not an actual inert control group. The result is there's 0 trials, 0, which were relied upon in this list of 6061 to license a routine injected vaccine on the CDC schedule that included a placebo, as well as 0 trials of a vaccine used as a control to license a routine injected vaccine on the CDC schedule. Ironically, by the way, this list supports the opposite of what it pretends to do. And if you want to know what was relied upon to license routine injected childhood vaccines, it's easy. Look at the clinical trial documents. That's what we do. And in fact, my submission to this committee went through every single vaccine that's a routine injected vaccine, and we cited precisely what the control was. Now, I'll just point out one quick thing here, too, is that the CNN fact-checked Secretary Kennedy's claim that there is no routine injected childhood vaccine that was licensed based on a placebo-controlled trial, and it relied on Dr. Scott's list, which at the time had about 248 trials listed as being inert. Secretary Kennedy then did exactly the analysis I did, put it out on a tweet, took it apart. Not one of those was relied upon to license a routine injected childhood vaccine, nor was it used as a control to license a routine injected childhood vaccine.
The whole point of developing or doing this list, this crowdsourcing or whatever, leading an internet effort for the 661 studies was all to prove Secretary Kennedy wrong when he said that there's never been any of the vaccines on childhood schedule that have had a true placebo-controlled, random-controlled trial. And you've just gone through the 661, and that statement's true. Dr. Scott, go ahead and, I guess try and refute that.
So, yeah, the reason why we did this project was to, yes, directly address through systematic evidence compilation the questions around the quantity and quality of clinical data supporting vaccine safety and efficacy. We found 1,000, we screened thousands. We've extracted data from 1,088 randomized controlled vaccine trials. We started our search in 1800, and studies were published from 1941 until 2025. Of those 1,088 studies that are randomized controlled trials, 661 used what we consider an inert placebo, generally saline, et cetera. There were a number of other control groups used historically for various reasons, partly for ethical considerations and partly just because things have developed over time. As far as this being an example of how there aren't enough data to support the safety and efficacy of vaccines, I don't see the logic there.
Well, I think Mr. Siri completely picked your 661 studies apart. You said, saline, et cetera. I think it's wondering what's the et cetera. Mr. Rogers, you kind of raised your hand. You want to speak to that?
Yes, ma'am, please. Thank you, Senator Johnson. So look, in Ph.D. programs, you have to read original sources and you have to define terms. Let's be crystal clear about the definitions of these terms, because the fate of the Republic depends on getting these definitions right. And Dr. Scott is playing fast and loose with these definitions, so let's be crystal clear about what we mean. Inert should mean that the substance does not cause a chemical or biological reaction in the body. When supporters of the status quo use the word inert, they can mean just about anything. Paul Offit routinely calls mercury and aluminum inert, even though they are known neurotoxicants. Philip Grandjean and Philip Langergan published, they're the best two toxicologists in the world. They published a study in 2014 that says both aluminum and ethyl mercury are known neurotoxicants. But the supporters of the status quo say that these things are safe, and they're not. They're absolutely not. In the context of vaccines, placebo should mean saline, as verified by independent third-party testing. That's not what the supporters of the status quo mean when they say placebo. The fact is the FDA has no regulations concerning the contents of placebos. So manufacturers can put whatever they want into the comparator intervention and can still call it a placebo by law. Furthermore, scientific journals have no regulations concerning the contents of placebos. Sometimes the manufacturers disclose them in connection with a study, and about 2/3 of the time they do not. And a double-blind randomized control trial should have two groups. A group that receives the vaccine, that's the treatment group, and a completely unvaccinated group. Given a saline placebo, that's the control group. That's not what the supporters of the status quo mean when they say randomized control trial. They compared two groups, but one group gets the new vaccine and another group gets a shot full of aluminum adjuvants. Or they compare a new shot to an older shot. But the one thing they never do is to compare a completely unvaccinated group with a vaccinated group, because everyone knows that such a trial would show harms. So if you go through all 1,704 trials in the database that Dr. Scott has put together, as Aaron Siri has done, you'll find that the inert ingredients are not inert, the placebo is not saline, and the randomized control trial does not have a completely unvaccinated control group. And we know that my assertion here is correct because on page 9 of his written statement, Dr. Scott states that vaccinated versus unvaccinated studies are especially prone to bias. It's hard to imagine a more Orwellian statement. Up is down, left is right, dogs are cats. And according to Dr. Scott, a proper vaccinated versus unvaccinated study is unethical. That's why we're in this mess. That's why we have an autism and chronic disease epidemic in this country.
Scott, first Dr. Scott respond to that.
Yeah.
Yeah, I'd be very surprised if you went through all 661 trials. We haven't even conducted the full analysis yet. But once
I think Mr. Siri,
yeah,
Mr. Siri kind of has.
You should join our team. Yeah.
He's got a pretty crack team doing that.
Yeah, smart guy.
If you let me make the decisions, I'll join your team.
Yeah, let's do it. Let's team up. So, yeah, first of all, yeah, we are. This is a work in progress. Hopefully it'll be published, and once it's published, I welcome any feedback for sure. In terms of how we defined controls, that has not been publicized yet because we haven't published this, okay? But we did break it down between inert placebos that were biologically inert and placebos that were immunologically inert. So biologically inert placebos primarily include saline or buffer or water. And so there are certainly many studies that met that criteria. Then there are adjuvant-only controls. So we separated all that.
But again, the whole point of the 661 studies was to prove Secretary Kennedy wrong when he never said, and I don't know the exact statement, but there's never been any vaccines on the childhood schedule that have had a true random control.
I have the quote here if you'd like.
Yeah, go ahead.
Oh, sure. So Secretary Kennedy said, this is what the CNN article reported, that, quote, 76 shots that children in this country receive, unquote, meaning routine injected vaccines on the CDC schedule, quote, none of them have been safety tested in pre-licensure studies against the placebo. And in response to that, the CNN article quotes Dr. Scott as saying that that made Dr. Scott's ears perk up, end quote. Scott, an infectious disease specialist at Stanford University, knew that the assertions couldn't be true, and now he says he has the proof, meaning Dr. Scott, quote unquote, knew the assertion couldn't be true before he even looked and did it. So whatever he's planning to publish, obviously he had his a priori belief beforehand.
So
I was familiar with the body of evidence. I wasn't aware that there were going to be 1,088.
So
Well, then why not start with the clinical trials that are actually published by the FDA and relied upon to license each vaccine?
We've included those as well.
Again, the problem with this discussion debate is it just gets into a lot of detail, and you have accusations going back and forth and assertions made back and forth. It is very difficult to follow, okay? Again, I personally think that Mr. Siri did a pretty good job of taking that 661 studies apart. But